All right, good evening, Professor E. This is Richie again. I'm doing the final assessment, the head-to-toe assessment for the final skills checkoff. So for the first thing, obviously, in a better condition, I would come in, conduct hand hygiene, use hand sanitizer, whatever the case is, introduce myself. My name is Richie, and I'm going to be doing a full head-to-toe assessment on you today. I'm going to pull the privacy curtain, check the patient's ID. So what's your name, ma'am? Jessica Briella. Okay, perfect. And then, do you have any allergies?
No.
Do you have any pain?
No.
Okay, perfect. After getting done with the first pain, allergies, assessment, I'm just going to do a couple of vitals. The first thing, I'm just going to get a heart rate from you. So for that one, I got 74 beats a minute. I'm going to do a pulse. Okay, so for the pulse again, normal pulse. I would also be able to use a thermometer to get the temperature, whether it was either oral, tympanic, temporal, whatever the one that you had available to you at that time. She's not sick or anything. She's probably just gonna have a normal temperature, 98.4 to probably 98.7, 98.8. So there's not gonna be any problems there. Also, I'd be able to use a pulse oximeter, get her O2 stats. She's having no current problems right now. She's probably gonna be in the 96 and up percentile for the O2 stats. After I do that, I'll go right into the eyes, just do an inspection with my little light here. Do an inspection on the actual eyeball itself, just to see if there's any conjunctive nastiness in there. I'm going to do a sensitivity to light, which is some of the cranial nerve check. Just see pupil dilation. Okay. Just have you stare off into the distance at the wall there. Okay. And have you follow the pen to your nose. Back. Okay. Perfect. Okay, so that's the perler right there with the location, sensitivity to light, how our eyeball functions, the vasoconstriction of the pupils. After do that, I'm going to go into the ears using an otoscope. And you see at the doctor's office, being able to look. Now with adults, you have to pull back and down to be able to look into the tympanic membrane, see if there's any swelling, any redness, full inspection, assessment of the area, tenderness in the ears, whether it's the outside of the ears are tender. Everything goes good with the ears. Move on to the mouth and throat. I'm gonna have her open up, say ah. Perfect. Just making sure the uvula actually contracts up there. Just looking for any swelling on the tongue, throat. Just any abnormalities, color, tenderness, again, all the same things. The assessment of both the throat and the inside of the mouth, the tongue, the teeth, the gums, all that. After doing that, I'm going to move on to the neck, check the rigidity of the trachea, check the lymph nodes. Yeah, the lymph nodes don't seem to be swollen, obviously she's not being affected with anything right now. Inspection of the trachea. Just making sure everything is good with the neck itself. Going into the hair, skin, nails. Got to do an inspection on the head. Just checking the scalp for excessive dandruff, color, lesions, stuff like that. I'm going to do a capillary refill on both her fingers and toes, squeezing. Just making sure she's got some solid blood flow going through. And also, let me see her too. Doing capillary refill on the toes as well. I'm just making sure she's got that full blood flow, no peripheral issues. I'm gonna ask her if she's had any changes with your hair in the last 3 months. Color changes, falling out, issues with your hair.
Yes.
Really?
Because I had a child.
Oh, okay. So, your hair is more full now or less full?
Less.
Less full because of you're not on prenatals anymore?
Mm-hmm.
Okay. Well, yeah, there's your change in hair, whether it's color, thickness, palpating it for temperature, moisture, color, hygiene, all that type of stuff all goes into factor. The next is going to be the thorax and lungs. Just checking the side, making sure she doesn't have any barrel chested from COPD. Just making sure she's breathing bilaterally with both lungs. Making sure there's any physical issues with anything you may see with the lungs or the chest in itself. As we did with the previous skills checkoff, I'll do a full pulmonary assessment where you're going to check the 10 different areas, starting with the top of the lungs. Just take deep breaths through your mouth. Just don't hyperventilate on me.
More breathing?
Yeah, just go do 2 more. So pretty normal breathing, no wheezing, no crackling, no abnormal sounds when it comes to the pulmonary assessment itself. From there, going into the heart assessment. The heart assessment is going to be looking for using the diaphragm to check the 5 major spots: the aortic, the pulmonic, the Erb's point, tricuspid and mitral area, with S2 being pretty prevalent in the pulmonary during the pulmonary check, and the S1 sounds being prevalent during the mitral valve check. After using the diaphragm to be able to check her normal heartbeat, I was able to hear most of her heart when I was doing the lungs as well. Then you would switch it over and use the bell as well to be able to check on the heart, checking for murmurs, whooshing sounds, maybe the valve isn't closing with the murmurs themselves. So really just doing a full check to see what is abnormal. The peripheral vascular for that, we did the capillary refill on the fingers. We also did the capillary refill on the toes. We're checking to make sure there's no puffiness, fluid overload, edematous going on. So we took care of that. Then we're going to do a inspection of the abdomen just like we did in skills checkoff 3. So I'm going to have her lay on her back. Just put your hands on right here. Now with the physical assessment that you do by just doing the inspection portion, you're going to look at everything first with the stomach itself, and then go to the palpate, percussion, all that kind of stuff after. So I would first just inspect, make sure that there's no distension, hernias, problems, because then I'm going to actually palpate and, well, I'll listen first. Okay, so for the abdominal assessment, you want to listen to the 4 quadrants at least, moving from left to right. You want to listen for hypoactive or hyperactive bowel sounds. We just had dinner a little bit ago, so her bowel is a little bit more active than if somebody who wasn't hungry or anything like that. So as far as the physical inspection is fine, and then listening, she's on a little bit of the hyperactive side for bowel sounds. Then we do some leg palpation. After the palpation, you do the percussion. The percussion is, depending on the sound you hear, you're gonna have a hollow stomach. Somebody who hasn't had anything to eat, you're not gonna have, really any sound at all for somebody who's had a pretty good meal themselves. So we do one round with the inspection, then we'll auscultate. After that, we'll do palpation. We'll do both light and deep palpation, just feeling for any sort of abnormalities. And then from there, we go into percussion, listen for sound, seeing just how their bowel sounds are going. Okay, the next for the neurological. Try to face me a little bit here. Okay. So for the level of consciousness, it's doing an assessment of what's today's date.
I honestly don't know.
Well, what month is it?
August.
August. What is the year?
2020.
And who's the president?
Trump.
Trump. Okay. So, level of consciousness by asking just a few short questions about, do you know where you are right now? You would be normally in a medical facility, asking the date, time, the president, which changes quite a bit. So after that, going into the grips and pushes. So have you put your hand straight out. Okay, push up against me. There we go. Push down. Okay, push away like you hate me. There we go. Pull me in like you love me. There you go. Okay, so the same thing for the legs. The same thing, push out. There we go. Pull down. So obviously the grips and pushes is good there. I would use the rubber mallet. I would hit just below the patellar tendon, that way to see the reflexes on the knee. I would do it on both sides just to make sure that she has the simple reflexes, and then she doesn't have orthostatic hypotension or gait or any misbalance or anything. For her being able to stand up, move around, just normal movement, she's pretty healthy overall. Moving into the musculoskeletal, I'm going to do the range of motion. So I'll have you put your arms out to the side of you, put them over your head. There you go, put them back down, come in front. There we go, back out. Have you bend your arms like this. Okay, back up. Yeah, so put your arms up. Okay, then bend your elbows this way, and bend the back. So we got shoulders, elbows, fingers, wrists, no issues there. Going into the lower extremities, we got obviously the knees and the ankle joints and everything that she was able to do. No problems with range of motion there. Next one is I'm going to have you stand up. And I'm going to have you slowly bend over. And so for the last one, I'm going to do the scoliosis screen. You have them slowly bend over, and then you just lightly feel the spine all the way. Just making sure you can feel the spine all the way through, then come back up. Feeling lightheaded or anything?
No.
Okay, so you can just sit back down. No hyperextension, no scoliosis there. You can definitely feel her spine from the back of her neck all the way down to basically her hips. Yeah, so that's the full head to toe assessment. Thank you so much.